Okay, well, it's 11 o'clock and let's get started. Good morning. My name is Jan Schmitz and I'm with the Edmonton Pride Seniors Group. It's February 17th and thank you all for attending our weekly Aging with Pride discussion group for the LGBTQ2S+ seniors and their allies. Thank you too to our partners, SAGE and the Pride Center of Edmonton. Before I introduce our speakers, I must acknowledge that we are located on Treaty 6 territory and respect the histories, languages, cultures of First Nations, Métis, Inuit, and all First Peoples of Canada whose presence continues to enrich our lives. 2 housekeeping items. Firstly, I must let you know that this session will be recorded for future use on our YouTube channel. If you don't wish your image to be recorded, please close your video feed. Secondly, may I remind you of our code of conduct outlined in your Zoom invitation and underscore a couple of points. Please respect the speaker by remaining muted during the talk. We will unmute you for the question and answers. Be mindful of our time limitations and keep your questions and comments as brief as possible so that everyone can participate. Anyone who wishes will be given an opportunity to ask a question before individuals who have already spoken will be recognized. And respect the confidentiality of the personal information. And now, and with great pleasure, I would like to introduce our guest speakers. As the re-elected MLA for Edmonton-Riverview since 2015, Lori Sigurdson has worked diligently to make life more affordable for Albertans. Her advocacy for appropriate and affordable housing for all Albertans is part of why she was re-elected in 2019. And then we have Janis Irwin, who was elected to the Legislature Assembly of Alberta as the representative for the constituency of Edmonton-Highlands-Norwood. Janis is currently the Official Opposition Deputy Whip and the critic for women and the LGBTQ2S+ issues. Lori, would you like to start, please?
Unmute myself. Well, good morning, everyone. Thank you so much for the invitation for myself and, of course, my colleague Janis Irwin to join you this morning. And I certainly see a lot of familiar faces. Eric, I've known Eric's story for a long time, and we have the same profession. We're both social workers, and I certainly appreciate all the work that he's doing in this area. And of course, Michael Fair, who we've worked with for so many years. Thanks, Michael, too, and so many others that are here today. So thank you again. And just maybe I'll add a few little pieces to my introduction. So when we were government, the NDP, back in 2015, I was the Minister of Seniors and Housing at that time, which sort of makes some of the reason perhaps why I've been allowed to come and speak with you, and I appreciate that very much. And now I am the critic for the same portfolio, seniors and housing and mental health and addictions. So of course, these are 2 significant portfolios that have, certainly during this UCP government, we've seen, pretty disturbing decisions by the government showing really their incompetence on many manners, their incompetence on the response to COVID, and how seniors sadly have been, I would say, disproportionately impacted in a negative way by this. And it didn't have to be this way, but it was, I think some of the bad policies the UCP has brought through. You just don't attack doctors and nurses during a pandemic. I mean, you work with those professionals. They're going above and beyond to support people. Certainly in, the first wave of COVID, we know that so many seniors died in continuing care facilities across this province. And there could have been more done. A lot of these were preventable deaths. And Alberta had some of the highest rates of death of seniors due to COVID in that first wave, which is a it just breaks my heart. It's a significant tragedy, and there could have been so much more done. Certainly we had asked, for that one site for workers, for example, a month earlier than the UCP put that in. And, so many people who worked at multiple facilities, because they're precarious workers cobbling together a job, unfortunately did transmit some of the illness to seniors who were very vulnerable, and many did pass away. So, I mean, the government makes important decisions that completely impact our lives. And so that's why it's important to have a competent government. And unfortunately, we don't really have that at the moment. And certainly Janice and I and all our colleagues are working hard each day to sort of shine the light on that, make it difficult for them to go ahead with some, mostly ideological view of how things should be. Whether it's based in fact or not is not really that relevant. And certainly one of the areas that Janice and I have been working on is just the terms of the opiate crisis and their, rejection really of the harm reduction model. And so many lives are being lost in that area right now. 4 people are dying a day. Again, these are like significant issues that are creating deaths that are preventable, but the UCP refuses to really look at the evidence, talk to the experts who are working in the fields, and it is obviously pretty disturbing. Certainly one of the things that I think impacted seniors more than other parts of our population is just the social isolation that was created by COVID. Programs, say you did live independently in your own home, we closed down community centers. Sometimes home care was canceled because resources are redeployed, to the crisis of the pandemic in the hospitals or other acute facilities. And seniors had to sort of make do. And there was a cost to that. And certainly we know that many people have been impacted by mental health, and sometimes there may be mobility issues, transportation issues, just opportunities to connect. It certainly took its toll. And I know that all of you probably have understanding of that lived experience. And so that's a significant concern for me. And just overall, as a social worker for many years, I mean, I'm always thinking about the social determinants of health, that we need affordable housing, we need to have, good income support programs. And one of the first things that UCP decided to do when they came in was to de-index those programs like the Alberta Seniors Benefit, AISH, income support right away off the hop. But guess what? They gave $4.7 billion to, profitable corporations. They threw billions to the KXL pipeline. But, regular folks like us, we had to carry the burden of that. And of course, that was something we were very proud of as government, that we did index, because of course, each year cost of living goes up, and we wanted to make sure people had money in their pockets. But this UCP government has certainly indicated to us that they are more interested in helping sort of a more elite part of the population than supporting regular Albertans. And certainly that's not our values as the NDP. And we want to make sure that everyone's included and that everyone has the supports they need. But unfortunately, seniors have been, I think, adversely impacted by COVID, the policies of the UCP government. And frankly, I'll just maybe stop talking right away here, but just I would say in closing that, you can just see the lack of integrity of this government. They made rules for us about what we could do during COVID, and then we had that Aloha Gate fiasco where their cabinet ministers flew to Hawaii, and the rest of us were responsible and weren't in close contact with loved ones, followed those rules. And then we saw them too at the Sky Palace dinner, where no protocols were being, anyway, these are just a couple examples. There's so many more. And in leadership, you want people with integrity, people you can trust. And I think this UCP government has certainly shown that. And I mean, there's so many other things to talk about in terms of seniors. And I'd really totally invite your comments and questions in this area, and really look forward to having a dialogue. So I'll stop there and I will let Janice go.
Wonderful. Well, I don't know why I agreed to follow Lori, but that was a silly move. But here we are. Thanks, Lori, for those remarks. And just, yeah, thanks to all of you for inviting us. I mean, I think this is my first time formally speaking to this group. Like Lori, I know a number of friendly faces in the crowd. But yeah, thank you to SAGE for the work that they do, and the Pride Center, and of course, Aging with Pride. It's an honor to be here with you virtually on Treaty 6 territory. Yeah, I mean, I guess I wanted to talk a little bit about, I guess, the work that I'm doing as the critic for status of women and 2S LGBTQ+ issues. But I preface that by saying, yeah, Lori and I get to work together on a number of issues that are really important to me and to my constituents, and particularly in my riding here in Edmonton-Highlands-Norwood. And a couple of those include housing, right? Now, housing is a really critical issue, not just for seniors, but every day I see unhoused folks in my communities that I represent. And I'm proud of the work that we did. I'll say we, although I watched from afar. I wasn't part of the NDP government, of course, because I was only elected in 2019. But I'm proud of the work that we did. But there's so much more that needs to be done, and particularly because we've had 3 years of regression basically under this UCP government. With cuts to affordable housing as one example. And I mean, all these issues are so much exacerbated by the pandemic. And, the other issue that Lori and I get to work together on a lot is, as she alluded to there, supporting folks who are struggling with addictions. And so harm reduction and mental health supports, and tackling the drug poisoning crisis that, like she said, is taking 4 Albertans a day. And it's not, it's not just folks, although there are a lot of folks in Boyle Street, Macaulay, and communities I represent who are unhoused and who we're losing, but we're also losing folks who are of other demographics. We're losing older folks. We're losing, young men in suburbia, right? And it's really, really been hard to, to see this government refusing to act, right? Because these are real humans that we're losing. It's an absolute public health crisis. So beyond that, just a little bit more focused on my critic portfolio. I'll start with the status of women piece, because my focus is often LGBTQ2S+ issues, so I don't want to lose sight of that one. And it's quite timely, because I've been having a few conversations with people just around the disproportionate impact of the pandemic on women, on working women, on senior women. I remember it was early in the pandemic, I think around April 2020. Time is very confusing, so I never know if my dates are correct, but we raised this issue in the legislature, and I said, mark my words, we are going to see an impact of women disproportionately having to exit the workforce, and we're not going to see them return at the numbers that their male counterparts will see. And so we talked. I said, what are your plans to center women in an economic recovery? And not only did we not get an answer, the UCP laughed at us, mocked us, and sure enough, fast forward a couple of years, we see the data that supports that. And so that's going to be something that Lori and me and our colleagues will continue to talk about, and will continue to raise in the legislature. Fun fact, we're back in the legislature next week, actually. So if you're wondering, like, oh, what are those politicians doing? Why are they at home with their cats? Well, we have been off for a little bit, but we are back. We are back next week. And so there'll be a budget, there'll be a throne speech, and lots of work from our team to hold this government to account. So those are, that's one issue with status of women. I would like to obviously talk about 2S LGBTQ plus issues. Similarly to women, we don't have as, robust data, but, the anecdotal data, and I'm sure from the conversations that many of you have been having, and perhaps even yourself, we know that the 2S LGBTQ plus community has been impacted, right? And we know that from conversations around isolation. We know that when we talk to queer and trans youth on the streets, right? And so talking to queer seniors, right, who are struggling with various issues. And like I said, the isolation one is a big one. And so, I would say that the pandemic should be compelling all of us, but particularly those of us who hold office, to really examine the gaps in the system and to see how many folks have been left behind by the fact that there are inadequate mental health supports. And that starts with kids in school, right? And our government has been, soon to be government, our caucus has been calling on this government to ensure that there are mental health supports for kids, right? Because they have been really impacted. And mental health supports for folks of all ages. But I really would like to just, draw attention to the fact that our community, the LGBTQ2S+ community, has really expressed concerns around mental health and loneliness and isolation. Lori touched on this a bit, just talking about the broader issues of affordability, and this might resonate with some of you, and it's not exclusive to our community, but oh my gosh, I've been inundated by messages and calls about folks who are just struggling right now, seeing their utility bills just through the roof, right? And it's pretty hard to hear those stories of folks who are having to choose between paying their rent and paying their bills and buying food and all the things that they're trying to manage, right? And it's hard when folks have lost employment, or folks who are seniors who are on fixed income. So those are some of the issues that are really, top of mind for me. And most importantly, I still feel like I'm new as a politician, although, some days it feels like I've been here for 10 years. Again, that time sure is confusing. But I really, there's some incredible wisdom in this room. And again, don't worry, I'm not being ageist. I just, think of Michael and Ron and some of the folks that I know in this chat who've seen a lot over the years. And I think we, as much as I can't handle Zoom sometimes because I spend my days in Zoom and my poor eyes are sore, I really value the opportunity to hear from you folks. So I think what Lori and I would like to do is just, throw it open to questions. We're headed back. This is really good timing. We're headed back to the legislature, as I said, and I would love to hear from you, what issues are top of mind for you? What should we be highlighting? What should we be focusing on? And listen, it doesn't, I'm not naive to the fact that as opposition, of course, we need to be critical of this government and we need to hold them to account. But I know, because I hear from folks all the time, all across this province, they want us to be more than just oppositional. They want us to be propositional, right? They want us to offer a vision of what we as an NDP government will do differently. People know that Jason Kenney and the UCP have a terrible track record. They don't need to be reminded every day of how awful Jason Kenney is, although Albertans do historically have short memories. So we have to do a little bit of that. But more importantly, we want to offer a hopeful vision for the people of Alberta so that they will put their trust in us to form government in 2023. So anything you can do to help us to form that vision, to frame that platform would be so much appreciated. So with that, I'll stop talking, and thanks again for the opportunity.
Okay, let's use the chat function and the little icon for the hands for our questions. And I see, Michael, you have a question. Please go ahead.
Yes, thank you, and thank to both of you for being here today. I wanted to first make a comment or two and then a question. To get back to partly what was being said, particularly about the impact on women. Of course, in the senior centers and housing, most of the largest number of people who died were women. Kind of thing, because that's who's in the senior homes as well. So it's not not only younger, but also older. It's really that. It's also striking that when you saw particularly men complaining that they couldn't visit, it was their mothers they wanted to visit. And when you saw women, they were talking about their parents they wanted to visit and to care for. It was striking to me how important it is. But my question is, and really partly to Laurie, one of the things, Laurie, that started before that for us, and I'm thinking about our group, the older gays and lesbian seniors, is that you provided an opportunity to work to provide some input that actually changed some policies within the government, and I think that's an area that I would like to see you address again, because for us that made some difference, and in the long term I think that continues to make a difference, kind of thing, that we were part of recommending training and what needed to be done. There were a variety of things that we did along those lines, and I do think that that's really significant. So perhaps you want to say a little bit more about that, Laurie or Janice?
Yeah, well, I so appreciated your input, and I know that one of the phenomenons that no one's proud about is that, as seniors age in the LGBTQ community, they may need to go into the lodge program, for example, in Alberta. But guess what? So they're living openly, and then they feel unsafe in the lodge program because sometimes there's others who aren't very respectful of their lifestyle choices. And to be frank, sometimes some of the staff in those areas, may not have, understanding and inclusive views. And so that was one of the important pieces that I'm so grateful for your contributions to, Michael and others, to have some training for those workers, and so that people were in a welcoming, safe environment. And absolutely, it's sort of an adage that has been attributed a lot to the developmentally delayed community, but nothing about us without us, that kind of thing. And certainly that's very much what we think as the New Democrats, is that we need to make sure that we're working directly with people with that lived experience, so that because they know what it's like. You guys are the experts, I'm not the expert. So anyway, I so appreciated that, and certainly an NDP government would continue that process. We want very much to make sure that the services are respectful and inclusive, and that's very key, Michael.
Thanks.
Thank you, Michael. Roy, would you like to go ahead with your question or comment?
Yes, thank you. I just wanted to mention, and I'm sure you're aware, that Michael and others within this group have put together a proposal for a facility that would accommodate LGBT plus individuals, seniors, and associates or partners. And I'm wondering if you've seen the proposal that's out in front and the kind of support that we could expect from a government level. I know that it has been presented to City Council, and we are hopeful that something like that can come along. We talked of, in fact, Janice, there was a school, I think it's Mount Carmel or something that's in your division, that recently was going to be closing, and because it's consolidated, whether that building would be something that could be transferred into a seniors complex for gay and lesbian individuals. So interested in that, and hoping that the two of you have seen the Hot Boys summer play, because it is really relevant into what's happened in Alberta with our friend Jason Kenney, and if not, I would recommend, even though it is going to Calgary. So just some thoughts about specifically about perhaps having a building constructed within Edmonton. That would be probably a first within Canada to have that kind of distinction. And also, I think it's critical that whoever's in government establish some type of an alliance with the gay community, so that you have points of references or people that you can approach and get opinions, ideas from, and whether that has already been established, I'm unfamiliar. So I'll leave it with you to respond. Thank you.
I love that. Well, I can start and then I'll throw it over to Lori because she'll probably have more context on the housing project. But first of all, I have to say I did not see the play. I know I'm probably one of the only MLAs who didn't, but only just because I've been like one of those pretty paranoid people about going to events. And I've managed, I think, to avoid COVID, although I tell people who knows, I may have had it and just didn't have any symptoms, but hopefully maybe I can get to it now that things feel a little bit safer. But yeah, no, I love that. I know a little bit about the project. I love the idea of repurposing. You're probably thinking of Mount Royal, which was one of the schools that closed after the consolidation of the new Highlands School. And I do actually know I've had a couple of folks in the Highlands neighborhood mention, they obviously want to see that, it's a beautiful space right in Highlands, beautiful green space there too. They want to see it used well, right? So would be happy to have these conversations about it. I'd be curious, but I'll throw it over to Lori first. I'd be curious to know if you said you've shared with the city, if you've shared with the province, and if so, if you've had any success. But I can, or actually, why don't you've got your mic still on. Have you shared it with the province?
Not that I'm aware of, but Michael is kind of one of the people that was leading the charge on that. So I'll let him speak more directly. But I do know that City Council has been approached.
Right. With the province, we've dealt with the department forget the exact title of the department that has land that they deal with, kind of thing, and they just came out with the report on housing. You probably have seen that it came out, which basically said they're going to try to get rid of. They really want to not be involved, and the property that they have made available technically is probably not within our reach in any kind of fashion, because it's the recommendations are there, they should be, but the way they're handling it is not going to be that way at all. And I would say, I'm not sure, we'll be happy to send the proposal, our perspectives to both of you. And we also have a newsletter I'm sure both of you would like as well, that would kind of goes along with that. Fine, so we'll do that.
Yeah, that'd be great, Michael and Roy. I'd appreciate getting that particular proposal, because I mean, I certainly had, I can remember having conversations about this idea, but I don't think I've ever seen the specific proposal. So that would be fabulous. And just to go back to one of the questions was, have you seen Hot Boy Summer? Yes, I have. And yeah, it was very cathartic for me. I got to laugh quite a bit. And you know what? It was truer than you think. I mean, I know it was fiction, but there was a lot of things that certainly rung true. And both Janice and I are on the private members committee, Bill's committee, and they had this little piece about the rodeo, of course, so that made me laugh quite extensively, I must say, because it was quite a charade in the committee. And anyway, yeah, it was very fun, and it's nice to see local artists, giving us another view, because sometimes we as politicians can be so heavy, we're always like, oh, this isn't working or whatever. So it was very fun just to go laugh our heads off, or I laughed my head off. So, I mean, I guess what else I could say is that, I mean, one of the, just so disturbing things is exactly that proposal where it looks like they're going to privatize affordable housing. They're not really funding the housing management body system. Like, we put $1.2 billion into affordable housing during our tenure. And you know what? That wasn't enough. We had such a huge hole to fill. These guys are putting in about 242 million over 3 years, which is completely insufficient. And we know Alberta already is below the national average in terms of housing proportional to population. And we have so much need in this area, and the UCP is only going to make it worse. And of course, the private sector is only interested in maybe a little bit below market. They're not interested in rent geared to income. They're interested in making a profit. And so I think it's kind of devastation for the sector. And obviously they've done very little on the affordable housing front since they've been elected. But besides this report, which will, privatize, and I just keep hoping that, they won't be government next year before they dismantle our whole system across our province, because I think that is going to be very sad news for all Albertans. And we need to make sure that, affordable housing is so fundamental to anybody's well-being, mental health, and, just part of that social determinants of health. And we know that that if people are well housed, guess what? It costs often less, because people who aren't well housed may use our emergency room system more, EMS, sometimes policing is increased. And we need to make sure that, like in the long term, it actually saves government money. But of course, UCP has a pretty short-sighted focus. And they're just, they're, as Janice said, next week, throne speech budget, Kenny's just gonna, who cares if people are being devastated in their own households? They're going to balance that budget, and they're going to continue to cut programs and give money to the elite corporations and say they're doing a great job, but it's really because there's almost $100 oil again. So it's nothing that we feel at our kitchen tables. The policies of the UCP are not supporting all Albertans, and certainly I think seniors have every reason to be concerned because there's just such a limited investment in affordable housing. So I'd be really grateful for having a copy of that report. So please do send it my way. And I think just one more thing, Roy, you said, well, would there be opportunity for an advisory committee or something like that regarding these kind of issues in your community? And I would say, that makes complete sense. And I'll let Janice share anything else she wants to. But I mean, as I said before, nothing about us without us. And we totally want to be creating policy, creating programs that meet your needs, and not just sort of, dictating what needs to happen. We need to understand your lived experience, and certainly, happy to do that. And, I know as an old social worker that's the best policies, are those ones that are, you create with people who are utilizing those programs. Thank you.
Thank you, Roy. We'll continue in order. So the next lineup will be Larry, followed by Sydney, and then followed by Martin. Larry, please go ahead.
Thanks, Jen, and thank you both for your comments. It strikes me, looking at a number of very different areas, healthcare, HIV care, addictions, mental health, now housing. Many of the programs that have been created really have been initiated through community effort, and that there is a real need to have a coordination with actual policy. And it seems to me these areas overlap one another. As you said, it's more expensive to look after people who do not have housing. And I'm wondering what the opportunity might be for an office of LGBTQ2S+ affairs that would actually ensure, the way we are trying to do with housing, that the needs of our community are represented everywhere. For example, important as this as a specific housing project is, the fact is it can't possibly meet the needs of all of the community, so that every facility needs to have policies that are in place. So I'd be interested in your comments on the notion of an office of LGBTQ affairs.
Yeah, and I mean, thanks, Larry. I love that idea. I mean, obviously, I can't speculate about what government would look like for us, but one of the, I think, hopeful signs of Rachel Notley's leadership is the fact that I was appointed the LGBTQ2S+ issues critic, right? So, we didn't have that position before, like naming it. We know that that's critical. And we've got a government right now, and again, this is me being being a little bit negative, but there's a positive point to this. We do have a government right now that kind of lumped everything together that they don't care about into one ministry. So culture, multiculturalism, status of women, threw them all together, right? And then they kind of deal with the gay stuff in there too, Like, okay, if I ask a question about LGBTQ issues in the legislature, it's usually the Minister for Status of Women or Associate Minister for Status of Women who responds, right? Because gosh knows Jason Kenney or any of the Jasons would never respond to one of those sorts of questions. Ooh, of course not, right? So, however, I would say, and I mean, you can see, and I mean, the track record of this government with LGBTQ issues is a long and horrendous one. And we don't need to look, we can look back to Bill 8, but we can also look more closely at, the reprehensible comments that the Premier, of course, has now apologized for. But those types of actions and remarks, say a lot about how much they value the community. And so I'm hopeful that it's something that can be, whether it's an office, whether it's part of a ministry, I'm hopeful that that's something that will be named under a government. But again, I mean, it's pretty hard to speculate. But noting that, I was honored to be able to have this critic area is a good first step for sure. So we will certainly. I know Lori and I are both taking some notes here, so we'll certainly pass this along too. Go ahead, Lori.
Yeah, thanks, Janice. Yeah, I really appreciate the question. I just want to say that one of the very first things the UCP did when they became government was to, terminate the seniors advocate, right? We had created in our government a standalone office for the seniors advocate, and of course that was staffed, and certainly many of Dr. Kwan Si, who was in that position, obviously, eminently qualified for that position. They said that they did that because, the health advocate could do the same thing. And then they proceeded to appoint the previous CEO of sort of the Conservative Party, Janet Harrington, to that position, who has no seniors experience at all, no health experience at all, but is a political appointment in a role that really should not be. I mean, we did extensive interviews, and it was a university professor with a specialization in seniors. So Dr. Kwan Si, who did a great job for us. Anyway, so it's just appalling. And this again is another indication of how little they care. And Janice, it made me laugh. I'm sorry, I'm a bit of a cynical politician, I suppose, but I had to laugh at your characterization of how they put everything they don't like into one ministry. Anyway, but that our leader, Rachel Notley, is trusted and she cares about Albertans, and certainly in a government under her, she will not do any of this. And one of the things that I've managed to confirm with her and get, and we're working on our platform, of course, for the upcoming election, is that she is committed to reinstating that office of seniors advocate and going a step further and making it independent, which is what we always wanted. And so then it's much more scrutiny on government and, more like the child and youth advocate, which is really important. And so I guess I'm telling you that because we're already, like, as Janice said before, we regress so much. We have to sort of establish this. And I think that within that, not only covering seniors issues, but I can see a focus being very much on the LGBTQ community. Not that we wouldn't do more than that. And as Janice says, like, even her critic role helps significantly because it does highlight the concerns and difficulties. I also want to talk about how the overlapping issues like affordable housing, mental health, all those things that you identified earlier in your comments, one thing can't fit it. There's no panacea. We know that. And we do have to have coordination. And another thing that we're working on is, we don't have the exact title, and it's not always great to have an in front of on a title. You sort of want to be visionary. So, but basically it's known as an anti-poverty strategy, and myself and some of my other colleagues are working on that. Maybe we'll call it a wellness strategy. I'm not sure, but it's looking at all of those pieces that you indicated and bringing them together. So, you know, thank you so much for your comments. That was, it is something that we have been working on, and we know that it's so important to get rid of those silos and work collaboratively regarding those multitude of issues, because yeah, one thing isn't going to fix it. So thank you very much. I really appreciate what you said.
Thank you, Larry. So next up will be Sydney, then Martin, then Ron. Please go ahead, Sydney.
Thank you. You had asked for budget input, first of all, and for me, the issue that has been an issue in Alberta since the 80s is still an issue, and I think it's something to sell. And it really is that, whatever you want to call it, whether it's multi-problem folks or multi-problem situations, that we could save so much money if we looked at people who fall through the net, and if we spent more time on that. And it's just such a dollar saving thing that I think somebody could really capitalize on it. And, you know, there's a lot of pain involved in those folks who are falling through the net in whatever spot in our society. So it also would just reduce kind of the ugliness of our current world, and I think make it more beautiful. So that would be my issue for your budget. The next one, I just wanted to thank Janis, and this is not, I don't mean to be cheesy and sucking up to politicians here. I just want you to know that a family member volunteered for both your campaigns, and oh my gosh, did you empower that person and help them to feel better about themselves. And so I just want to point out that I think there's a place for mentoring and talking about how you truly should treat volunteers. And I just wanted to point out that you were a very rich and effective example of using volunteers wisely, even when you were under the rush, which I find horrifying of a campaign. So anyway, many thanks. And then finally, you mentioned, both of you, that you are working on the opiate issue. And I want to know what each of us today can do as citizens. And I want to know if there's anything we should be aware of as a committee to support you in that.
Gosh, well, maybe, yeah, Laura, why don't I start and then throw it back to you, particularly on the opioid piece. But no, just thanks for that, Sydney. That's really nice. And I think, you know, one of the things that I always try to acknowledge whenever I give a talk is the fact that, you know, representation in politics matters, right? And, you know, we can look to Michael and we can look to folks who were trailblazers for sure on this. But, you know, the reality is it's 2022, and how am I the only you know, openly, let's focus on the openly part, openly queer MLA in the legislature, right? You know, and I also have to acknowledge my privilege. I'm a white cisgender woman, right? With a whole lot of privilege. And so, you know, my hope is that we can continue to engage folks in politics. And my hope is that in 2023, we have a slate, or even sooner, we have a slate of candidates who are more representative of Alberta, right? So I want more racialized folks. I'd love to have, you know, other members of the LGBTQ2S+ community in that legislature alongside me, right? I'd love to see a trans person elected. I'd love to see Indigenous folks in the legislature. There's so much more work to be done. And so it's on people like me and Lori and our colleagues who have that privilege to, you know, to open up these spaces and to talk to people and to encourage them to run for office, right? So that we can have, you know, like you said, those powerful conversations, like even being mentors to folks. So absolutely. And yeah, and just on your first point, just around what we can do to you know, raise issues of folks who are kind of falling through the cracks, and how we can support people. You know, again, I can point to the example of unhoused folks in my communities that I represent. And gosh, I know Lori and me and Marie Renaud and others in our caucus have asked a lot of questions of this government. And, you know, I remember one of the questions I asked was around supportive housing. We've got examples of effective supportive housing in this province, in my own riding. Ambrose Place is a great example. It's a Naganan housing venture that, it takes a harm reduction approach. And so they take some of the hardest to house folks in our communities, people who've lived rough for a long time, and many with disabilities, multiple disabilities, and they house them. And supportive housing is such an example, Sydney, of saving money, right? And I remember asking in the legislature, like, why do you refuse to invest in supportive housing projects if the moral argument of saving lives isn't resonating with you? How about the fact that you're actually going to save money? No surprise, neither of those convinced them, right? But so no, Sydney, it's our commitment to, continue to talk about these issues and continue to amplify the voices of those folks who are left behind by this government. Laurie, I'll throw it over to you.
Yeah. Well, thank you, Sydney. And certainly, you're sort of touching a whole bunch of issues are the reasons why I even put myself in harm's way, it feels like, to be a politician, because I worked as a social worker for 30 years. And I saw exactly what you're talking about, people falling through the cracks, not being supported by our systems. I was frontline when Ralph Klein was the premier, and he cut public programs by 50%. So I guess I got progressively angry more and more through my career as a social worker, and decided that, in my sphere, I didn't have enough power to make the change that would make the difference. And so, and these are not, they call them wicked issues. I've heard that before, wicked problems, and they're complex. It's not any kind of one thing, as we know, that will fit them. So anyway, I said no to Rachel many times, but finally I agreed, and I did run, and I'm very proud of our record as government. But yeah, Alberta's not perfect. There's still issues, huge, but we did reduce child poverty by 50%. I mean, that's just a stat that just springs up, and that was in a short period of time. So the political will was there, under Rachel Notley. She cares about Albertans, and she wants to make sure that everyone has those supports so they can live in dignity, like you're talking about, Sydney. That's absolutely, totally why I'm sitting here today talking to you, because that's why I became a politician, because I sometimes feel like I was crazy, and I certainly had to be kind of pushed into it. But it's so important to be at the decision-making table. And of course, now as Janis and I are in opposition, so it's more difficult, of course. And we want to influence, and we want to challenge and be propositional, as Janis said, but it's tough on this side because you can't make those decisions. So obviously that's why it's so important for us to, be a government next time, so we can make some difference, and then make it a real difference. And I already had talked about sort of our anti-poverty strategy that we're talking about. So we are developing those policies that hopefully are, have that secure social safety net. But as I said, these are complex problems. And then you did ask about the opiate crisis and what can you do? And I mean, one of the first things I think that people need to is perhaps educate themselves. And one of the things the UCP likes to say is that, the NDP is going to go deliver free drugs to people's doors. And we're going to, we have all these NDP drug sites. It's just ridiculous, the rhetoric that they are slamming sort of the harm reduction model. Supervised consumption sites save lives. No one has ever died at one of those sites. We know we need to support people where they're at. And people aren't just going to go into treatment. Even, the UCP thinks people are just going to go into treatment. People need to be supported where they're at. And guess what? Those workers in supervised consumption services help them with income support, healthcare, develop relationships with them, maybe get them into affordable housing. They're doing all this stuff. But guess what? The UCP is cutting those services across the province. It's a travesty. It's horrific. So it is kind of a controversial issue. And a lot of people think, what? And then they listen to what the UCP say, and then they make out that we don't care about treatment, but we do care about treatment. We care about the whole continuum. But what's missing right now is the harm reduction. And with 4 Albertans dying a day, I mean, that's just heartbreaking that many people on there, these are people who don't want to die. Yes, they use drugs, but they shouldn't have to die because they use them. And the toxic drug supplies is, horrific out there. Anyway, and the UCP are just putting their hands over their eyes and pretending like people are just going to quit cold turkey and go into treatment. No, they're not. So I guess one of the things is just to understand the issue. And I know Moms Stop the Harm. That's an organization of moms whose children have died due to the opiate crisis. And they're an amazing group of women who understand all of this. Them and others are having a rally at the legislature on the 23rd of February at noon, if you're interested, or, I don't know how involved you are in social media, supporting that in terms of, understanding the issue and seeing what's missing. Anyway, that's quite a bit of talking. So I will stop, but yeah, thanks so much, Sydney.
Thank you, Sydney. We have about 7 minutes left, and we have at least 4 questions or 3 questions. Martin wrote in the chat, wondering about a focus on intersectionality and aging, gender, race, HIV status. Martin, did you want to speak to that?
Maybe I'll just say something related to that, but maybe not, a little tangential, because one of the issues that I'm beginning my 3rd week of retirement. And so I worked in Alberta Health Services as a mental health therapist for the last 20 years. And so one of the things that I'm very aware of recently is kind of policies enactment and, how policy makes a difference. And so when I'm thinking about intersectionality, I'm thinking about the importance of the development end of it. So it's all well and good to put training in place, for example, in terms of aging for folks with of gender and sexual minorities. But how does that actually change practice? And so, just commenting on that, just the significance of, of not just thinking about what needs to be done in terms of bricks and mortar and what needs to be done in terms of training, but also what needs to be done to actually work with folks at the coalface, to work with communities, to be sure that policy actually is enacted, and that when it's enacted, it's helpful. So, just a few thoughts.
No, I love it, Martin, and it's very timely because I may have just gone on a rant about this last night. So I'll try to keep my rant shorter and less ragey. But the reality is, and again, apologies for starting on a negative note, but this is a government and a premier who's called intersectionality, quote, a kooky theory, and has very much dismissed any sort of intersectional approach. And we can look at the power of taking an intersectional lens to policy. And we can see that through the work that the NDP did when they were in government, Gender-Based Analysis Plus, which was essentially a framework to ensure that any policy decisions, any proposed legislation would be assessed through the impact of said, documents, legislation, whatever it might be, on marginalized folks, right? Or on, on women, on to us LGBTQ plus populations, on racialized folks. The list goes on. And of course, no surprise, this government scrapped that approach entirely. And when asked about how they are now, doing an analysis on any of their policy pieces, they don't have an answer. And from what I'm hearing from folks within government, within ministries, are saying like, yeah, it's completely gone. And I mean, Status of Women, which was the ministry that was responsible, that housed gender-based analysis, has been decimated. It's gone from multiple, folks working in different areas to, I think last time I checked, about 3 people. So there's no way that this work is being done. And so you can bank on the fact, Martin, that if we form a government, we will ensure that policy decisions are based on evidence and are made after thorough analysis. So Lori, I don't know if you wanted to add to that at all.
I just say in the interest of time, because we're almost out, let's go ahead, Jan.
Thank you, Martin. Ron, please go ahead. We have about 4 minutes.
I'll try my best to condense it down as much as possible. I just want to comment briefly on one aspect that we have talked about here, and that is harm reduction. I get so frustrated having listened to the news over the last couple of years, how the UCP government handles harm reduction. I was lucky that when my health first recovered to the point again recently that I could actually get involved back in the community. One of the first organizations I got involved with was what was previously known as the Edmonton Men's Health Collective, and was on the community advisory team that started the peer-and-peer harm reduction program for queer youth. And having been still a part of that community, we periodically get report backs from the coordinators and whatnot. And it is stunning how many people that outreach program providing safe supplies has saved lives on the spot. On the spot, their coordinator has gone out to provide supplies and had to use their naloxone kit in order to save somebody, you know. So seeing the lack of recognition that harm reduction works just gets me going. The other one I wanted to talk about is what's called the Renters Assistance Program. Unfortunately, under the NDP government, the then direct tenant program was pretty much put to bed. Which meant a lot of low-income people had no access to money because it simply ran out of money. And it shut down. They stopped taking applications. The directed tenant is handled locally in Edmonton here by the Capital Region Housing Authority. And they built up hundreds and hundreds of applications because there was such a waiting list that for the last couple of years, basically they could not deal with all these people were just not able to access that. Now in July of this year, that the federal government had developed their own program and started working with other provinces. And in July, they coordinated with the Alberta government and provided them some additional funding. So the UCP were able to open up this program again for the renters assistance benefit. Some of the challenges of that is that, for example, as a senior who relies on that, if I did not have that, I would have to move out of my home of 23 years. Without it, there's just no question I could not afford to live here. And I'm only paying $900 a month rent. But without that, I could not live here. I just recently haven't had a chance to talk to them. My downstairs neighbor is a woman who had to have a mastectomy recently due to cancer. She's had cancer come back again. She's no longer able to go into the workforce. She doesn't know how she's going to pay her rent. I spoke to her about this, but even still, in the information I received from the Savita Capital Region Housing Authority, it's still going to be 2 months for them to even get to the application because they have to go through this whole process. Bottom line is the renters assistance benefit is great to have, but it is still unmanageable. For example, I was given an opportunity to write stories for the Edmonton Heritage Council on their Edmonton City Museum project. I had to beg and plead with them to assign that dollar amount that I was paid to someone else, so I didn't get it taxable because it would have reduced my income, not this year, not next year, but the year after, because my taxable income would have been too high. There's no off-ramp to be able to say, oh, for this month, I can actually make a few dollars, you know, doing a project from home. There's one coming up from HIV Edmonton, which I've been asked to consider working for a period of time. I'm old. I mean, I'm barely alive. I won't know if I'm alive next year even to deal with this. But
thanks, Ron. I appreciate it. It was difficult to hear your question there, but we've run out of time. Sorry, Thea, we can't get to you. Women, you're doing great work. Keep it up. I think we could have had this session run for 2 hours, and maybe you'd be willing to come back and join us on another time. Do you have any final words you'd like to say to us? You have a minute.
No, just I wanted to just start by saying just thanks to Ron, and he might have disappeared there, but if someone's in contact with him, we'd love to, please let him know that he can reach out, because I feel bad that he didn't get a chance to finish. But just, yeah, thanks for the work that all of you are doing. Thanks for having us. Lori, I'll give you the last word.
Yeah, thank you so much. Obviously, it was very rich for me to hear your comments, and it feels very much like we're on the same page in a lot of our concerns and what we value as Albertans. So that's important. And certainly with Ron, the last comments and things like that, there may be something more we can do for you. And there's some things I'd like to address, but I know we don't have time. But sure, I'd come back again, Jan, if you make space for us. So yeah, thanks so much, everyone.
Thank you.
So
Well, thank you, Janice and Lori, for such an inspiring talk. And thank you to Kim Lauren for your signing and technical experience. And thank you to all of you. We hope we see you next week when our speakers will be Sarah and Basil from the Edmonton Mennonite Center for Newcomers, the Newcomer LGBTQ program. Please fill out the survey that we're going to send you, and you can contact us at Aging with Pride at pridecenter@edmonton.ca. And now I return our meeting to our host.
Hi, everyone. I will see you next week. See you later.